So good evening and thanks for joining in. We are going to have this webinar, TCM for Cancer Support, with Dean and Professor Joana Zhao. Today we'll have a little introduction by myself in the webinar series. We'll then begin the TCM for Cancer Support symptoms. Then we will have a poll, and after that, Dr. Joana Zhao will have time to answer your questions. This is the 8th webinar of our TCM webinar series. In this series, we will look into how TCM can help heal many of the common diseases that Americans face today. So please join us to learn more. Our next webinar is June 13th at 5 p.m., and that is our TCM for dietary therapy. And in exciting news, in July, our TCM webinar series will have a new spin on the webinar. So July, we will have TCM for insomnia, but we will do it in a different format. In July, TCM for insomnia will feature a live demo between the doctor and the patient, so you'll get to see a live interaction between that. So in that, you'll get to see on our homepage here, if you click reserve your seat in our free webinar, right here underneath University News and Events. If you click on that, it will go to this page. And this is where you can sign up for all of our different things, open houses, webinars, and seminars. And you will see down here our live webinars. So this is our webinar today. And in July, as I said, we will now be doing an online clinical demo, which is really cool. Like I said, you'll get to see more doctor-patient interaction within that. All right, and just so you guys know, if you have any questions, please feel free to, on the side of your screen, there's a GoToWebinar pop-up, and you can ask the professor questions, which she will answer at the end of the lecture. So just a little bit about Joana Zhao. She received her education from Shanghai University of Traditional Chinese Medicine in the People's Republic of China, where she trained in both Western medicine and TCM. Professor Zhao teaches in the departments of TCM acupuncture and TCM herbology, and is a faculty member of the 5 Branches DAOM program. Joana has spent more than a quarter of a century teaching and practicing TCM in China and the U.S., working with local oncologists and developing specialties in cancer, immune diseases, and mental emotional disorders. Joana has lectured at 5 Branches International Symposium on Women's TCM and on Pediatric TCM. So she's also been the lead speaker at national conferences on female reproductive cancer and leukemia. So please welcome her and enjoy her lecture. This is our esteemed professor and dean of 5 Branches University, Joana Zhao.
Hi, everybody. My name is Joana Zhao, and Faye already introduced me. For the supporting the healing, supported the healing, when I got this topic, I said that that's very important for everybody. So that's why I like to spend a little bit of time with you and to discuss how Chinese medicine, acupuncture, can help support the cancer patient and support the healing. Okay. So, talk about the cancer. In most people's minds, is related with death. Of course, many different diseases can also relate with death. But the most frightened of all diseases is cancer. You know, the cancer, the words, actually is a crab. You know, the crab, if you think about the crab, we always say, who is the first person eat crab in this world is very brave. Because the crab has 8 legs and the crab everywhere. And the cancer, just like that, goes everywhere in person's body if we are not taking care of it. if somebody get it. So, but the problem is the cancer patient is not getting less and less like other diseases, certain other diseases. The cancer, recently, the number of cancer patients has increased. Some of the cancers are due to pollution of the modern industry area, and some because of the chemical using, toxic, and also, for example, like fertilizers and preserved food, they all become a problem. So, because today we talk about the traditional Chinese medicine and acupuncture, how do we help? Do you know in China, in traditional Chinese medicine, we always talk about the yin and the yang, 5 elements, 8 differentiations, and what this come from? Actually, if you look at the old Chinese history book, even just the history book, talk about 3,000 years ago, we already started using Chinese herbs and some acupuncture treatment to help the diseases, include right now the modern medicine called cancer. So in Chinese medicine, since today I'm talking to the public, so and it's not like you already, some of them maybe already studied acupuncture, but some of them really know acupuncture herbs, what do you actually talk about, right? So actually, acupuncture and herbal treatment has been in this world for 300,000 years. But the cancer treatment, how do you treat or how do you support? Do you know the cancer actually in Chinese medicine? We talk about the inflammation. And reducing inflammation is one of the very strong tool in Chinese medicine and acupuncture. We talk about the earth, we talk about the human being, we talk about the sky, which is heaven. So we have the one we talk about called heaven and the earth. Human being in between heaven and earth. We dance with the heaven and the earth, which is, if we live in this area, live in this world, we breathe the air, we eat the food, we drink the water, everything related with our health. If the water is polluted, if the air has got a whole bunch pollution, and what happened to our body? So that's why it increased the cancer patient now. This is the one thing we have to actually deal with. I'd like to use today's chance to actually talk about that. And also, if a patient got a cancer, they have a pain. So how do we stop the pain? Now we talk about, now people use pain medicine, painkiller, and even people use opium. What happened after that? Many patients, they actually got trouble from the addiction. So that also I'd like to share some of them with you. So for how do we see, as a Chinese medicine doctor, how do we see these diseases? How do we reduce patients' stress? Because the minute somebody had a cancer, first thing we think about, oh my God, I don't want to get that. Why is me? And all these things will come out. What happened is stress. Of course, you go see the doctor. Doctor will give you some good ideas. For example, maybe you need an operation. Maybe you need a chemotherapy. Maybe you need a radiation or hormone therapy. Anything you can mention, right? So what happened to put a cancer patient become very stressful? I really have the problem. Now I have to think about it. If I deal with chemo, I will have a chemo side effect. If I deal with a hormone, I don't know what happened with me. Yeah. If you deal radiation, lots of heat, and all these can help me or just temporarily. So I met so many patients. They come to me, and this is their question. Want me to answer. Of course, very difficult for as a practitioner to answer that question. I can't say, oh, you don't do radiation. Oh, you have to do chemo. I'm not the MD in America, so I'm an acupuncturist and Chinese medicine doctor. So I had to work with the patients and work with the oncologist sometimes to find a good way for patient can actually, first thing important is reduce the stress. Because in Chinese medicine, stress can cause lots of problems. For example, we said that stress causes liver qi stagnation, stress causes spleen qi deficiency, and extra. So if you have a stress, you also can cause stagnation. The stagnation of the qi, which is a vital energy, qi, qi, which is vital energy, and also can affect the blood circulation, causes stasis. So how do we reduce that? I will talk about that. And also, if the cancer patient not just, okay, I got a cancer, I am waiting for die. No, that is very negative. When you get a cancer, maybe the doctor will tell you, oh, so-and-so, you only have how many years to live, or even months to live. I told the patient, of course you have to listen what the doctor told you, but you have to listen to yourself, your own body. How do you fight? How do you work? We call, if you already have a cancer, how do you dance with the wolf? The cancer is a wolf. He's going to eat you. You try to run away, he still follow you. And or you dance with the wolf. You work with the wolf, and maybe you will survive. So that is the one, how to increase living quality. Yeah, that's also our Chinese medicine doctor and acupuncturist want to work with patient. And also, I will just talk about the reduced side effects, right? And the chemo, radiation, and the whatever. So for example, somebody who has breast cancer, and maybe the doctor think you had to do the chemotherapy, which can save your life. And you did the research, you found out that this is a good thing for you to do it. So most of the people will use the 5-FU IV, right? So what happened, it might help you to reduce the cancer and get rid of cancer if it's initial stage, beginning stage. But what happened is you will have because of this medicine, we have to face it. It is medicine. And eliminate bone marrow. So what happened if you eliminate bone marrow? Your white blood cell is going to go down. You have no energy. And also, you have another side effect, which is the stomach and the intestinal reaction. Gradually, you can't eat what the food that you like to eat. So these two side effects, because the 5-FU works for breast cancer, but we had to face to these two side effects. As a Chinese medicine doctor and acupuncturist, I'm working for many breast cancer patients and help them to work with us and work with the oncologist. And many of them have very good results. And some patients, living with until now about 20 years or 30 years, and they're doing very well. So we can work with the patient to actually help them to reduce the side effects. Okay, can overcome the side effects. And number 4, we talk about alleviates the pain, because some cancer, especially the later stage, and will have some pain, can be very excruciatingly pain. So how do we do it? We also still want to keep their life quality, and we don't want them to miserable and take the pain medicine and morphine, and finally can't really actually function. So the Chinese medicine acupuncture, actually, especially the acupuncture, really works for eliminate pain, eliminate the pain, and help the patient and overcome the pain. Okay. So right now, because the time is very short, I like to give some samples. I choose 3 samples. One is a gastric carcinoma, and one is liver cancer, and one is lung cancer. Because, I come from China. I see the patient, and these 3 cancer is very common. And also, I came to this country, and I practice in 5 branches university, in the clinic, and in my own clinic too. I see some patients have the stomach cancer and the liver and the lung cancer. Of course, many other cancers. But today, the time, I just give examples how the acupuncture, how does traditional Chinese medicine help these patients. Talk about the gastric carcinoma, the manifestations I listed here, many of you already know. Epigastric discomfort and the pain. This is one of the very common feeling the patient in the beginning. And vomiting, nausea, and the vomiting with the blood. And also you see the stool has a black color. And later patient will feel the mass in this epigastric area. Epi means above, so above the epigastric area, feel the mass. Why I want to list that? Because Chinese medicine not only just help to support the cancer patient treatment, also preventing is our main purpose. How to prevent, find the things early, or just try to avoid it as possible. So, for example, if you see somebody who vomiting without a reason, or after eat, vomited right away, you have to think about something not right. If the patient is not pregnant, something not right. And doesn't matter for man or woman, the vomiting with the blood. Of course, vomiting with blood can be stomach ulcer. And stool black can be stomach ulcer. So sometimes can be confused. But I do want to tell you the gastric carcinoma, the early stages. The early stage, patient can have no obvious symptoms. That's scary. And also, early stage, I just said before, confused with gastritis. And confused with people who dislike food and the stress, whatever, and anorexia, and the gastric ulcer. I just said gastric ulcer can have bleeding, can have black stool. So how do you distinguish it, right? How do you find out, and how do you help? What I do is, if the patient come to my clinic, if they have these symptoms, I will do acupuncture treatment. And I also will give the herbs to help to stop the symptoms. If these symptoms after my herb for a week or 2 still there, I will put a question mark and discuss with patients. From that, I want to talk a little bit, go to the etiology. So how the gastric carcinoma sometimes will happen. As far as we know, they are related with something. So I did a research when I was in China, in Ningbo city. That city is nearby the ocean. It's very famous, fishing, and now become a very modern city. And a long time ago, it's countryside, and the ocean side. And what happened, the people in one of the ocean village, they have so many stomach cancer, and they don't know what's going on. Is it a genetic reason? We found out it's not really. If you want to say genetic, you can say that because, the family, generation to generation to generation, maybe they are eating similar food. Maybe they like certain food that by generation transferred to another generation. So look like it's a genetic reason, but actually sometimes it's not. And also this village, they love to eat very salty fish, dry fish. That salty dry fish, we found out, too much salt intake is one of the actually cause stomach problem, ulcer, and became cancer. Of course, carcinogenic substance also is another thing, such as nitrosamines, sodium nitrate, hydrocarbon, etc. So we have many food having that. So now I want to talk one of my patients, actually not with the cancer or in the stomach. The cancer become leukemia, a child. Yeah. So what happened is the one child, and he loves hot dogs. He almost eats hot dog every day. Of course, if it's organic or hot dog, different. I don't know what kind of hot dog he's eating. I think it must have a lot sodium nitrate. So for years and years, hot dog is his food. And later I treated him because they come for leukemia. From my knowledge, I think that might be the reason. Yeah. So gastric carcinoma, it's the same thing. If you eat too much chemical stuff, we have to be careful. That's the prevention, okay? Some TCM diagnosis I put over here in Chinese, but I also translated it. 反胃. Somebody will, if you see the Chinese doctor, maybe they tell you, oh, you have a 反胃. What is that? Regurgitation. Yeah, after you eat, suddenly want to throw up. Another one is 胃脘痛, epigastric pain. Another one is called 一膈, difficult in swallow the food. You feel something there in the esophagus or in the, way. Feel not drinking water even have problem. Another one is the 心腹痞, which is fullness in the epigastric. This not necessarily is a cancer, but it possibly, related. So, in Chinese medicine, the pathogenesis cause of disease is emotional disturbance. It's very important, the emotional disturbance. We also did some research, we found out. Today I don't have time to talk about that. Another one is improper diet. So we just talk about it, a whole bunch, and some salt and nitrate, sodium nitrate, whatever. Of course, if you eat a hot dog once a month, then no problem. Even sodium nitrate, I don't think it will hurt you, right? So long-term deficiency of the spleen and the stomach, that's the one we talk in Chinese TCM terminology. We think the channel, the meridian of the stomach and spleen channel deficiency, it will cause digestive function problem, and the too long, that also can cause ulcer and become cancer. And number 4, the liver channel, I'm talking about liver, it's called the liver channel, fails to maintain the free flow of the qi. We said in Chinese medicine, the liver channel, helps the free flows of the qi. Why? If the free flow of the qi is not good, then and the qi is not free flow, means the stress and the stagnation. Hopefully you I use a little bit of TCM terminology and hopefully not to confuse you. Because if you come to see the Chinese medicine doctor, they might tell you that. And then you know what it's about. And the stomach qi fails to descend. It means poor digestion, you're always belching. belching. Why? Because the qi is not go down. Stomach qi is supposed to go down as it goes up. Now you vomit. And dampness, we talk about the inflammation is a dampness in TCM. And the phlegm, toxic heat, inflammation, right? And blood stasis accumulate in the stomach, which is cause gastric cancer. Leads that. So how do we support that treatment? Soothe the liver channel and regulate the function of the stomach channel. So I will, because today we talk about how do we support, I will give you one sample which is I use a lot for the patient to protect or to prevent, or even you have some problem, you can start to use it. 炙甘草, which is roasted local rice. It's very simple. You go to health food store or some other store, they will send you some local rice candy, right? So that's the local rice. Why they do that? It's good for the digestion and good for the qi. Yeah, it's roasted one. Okay, you can use. And also, how do we move the qi, help the qi, and we relieve the pain? There's another two things which is you can find it everywhere you want. Green tea. Yeah, green tea. Green tea also have many functions. Of course, they can, help your stomach and everything. Green tea is very good for relieve the pain. And also, chenpi is an orange peel. But they put a chenpi means the old orange peel. Very old. Yeah. But if you don't have old orange peel, that's okay. You can use fresh one, but have to dry it and put in the green tea, and you see, and help release the pain. TCM support treatments, support chemotherapy or other treatments. For example, I have two formulas I like to introduce to you. But these formulas are very simple and very useful. One is called I call the green tea formula. I have a green tea, you have a roasted local rice, we just talked about, then we have an orange peel. You have already introduced to you these three. The last one is also hawthorn, fruit. It's a fruit. For digestion, it's very good. Charred the hawthorn and together, and put together and make a tea for you. Then you ask how much you want me to put in. Okay, the green tea you only need, like 10 pieces, 10 to 15 pieces of leaf. It's good enough. And roasted local rice, orange peel, and also the hawthorn. Yeah, it's like 1 teaspoon each for the whole day cup of the tea. You can drink the whole day. You just put the water in, hot water in. And increase immune energetic system, because we talk about the cancer treatment, we also need to help the immune energy. And also if preventing the immune energy even more important. So we have a couple of herbs I'd like to introduce to you. You can make a formula. One is astragalus, huang qi. One is American ginseng. Another one we call the juhua, chrysanthemum. A beautiful chrysanthemum, right? But that's the one for the herbal, okay? Not everywhere chrysanthemum, colorful chrysanthemum you can use. It's a small yellowish or white chrysanthemum. And a tangui angelica. And these are for increased immune energy, okay? If you have a question and later about the gastric cancer, we can talk about later, okay? So now the second one I want to introduce to you, how do we treat it, is the liver cancer. The primary type of those originating in hepatitis problem, hepatic cells, or intrahepatic duct. So the second one we talk about the metastasized type. Those originate in other regions and moving to the liver. That's happened a lot. From different organs, cancer goes to the liver. And number 3 is history of a chronic vital. Actually, I was talking about in the first, actually, just in the last one. Viral hepatitis, special hepatitis B. And once I went to Stanford hepatitis, the the prevent center, and we had a talk about hepatitis. Hepatitis B, I see many, actually in China, I treating many patients who have the history, hepatitis B become liver cancer, and unfortunately. So if somebody in your family have hepatitis B, you should really help them and get treatment and reduce the inflammation, try to avoid or delay liver cancer problem. Okay. And also cirrhosis, hepatocirrhosis, that's also the liver, hard liver. So liver cancer, the manifestations are pain in the right gastric area, but a lot of time we think about, it's a stomach pain, no problem. Actually, you have to, if it's the right side, you have to pay attention, okay? And people lose weight very fast, and they dislike food, no energy, and also liver enlargement progressively. In Chinese medicine, we call the 胀结 abdominal mass. That you already, in the right side, you can feel it. And the 黄疸, because if it's in the loop, and jaundice happens. Liver cancer in TCM, TCM is a traditional Chinese medicine diagnosis. We have a disorder of qi, blood dampness, and heat. That's why we will do diagnosis, help you. And blood stasis and toxics, and also deficiency of the qi and the blood, and the emotional upset with mental depression. So if you go, somebody who has liver problem and liver cancer, and that TCM doctor will tell you part of the diagnosis. And this also the diagnosis to us, if somebody doesn't have a liver cancer, you have all these symptoms, we will say, okay, you have to be careful, you don't want to get a deep problem. Liver cancer TCM supporting treatments. I also have 4 for you. You can use it. And the preventing, and also for actually treatment support. Support, for example, somebody already doing chemo or some other treatments, and you can have a black tea. So before, you remember I talk about green tea. Now black tea is a fermented tea, and more enzyme. It's good for the liver cancer patient. And sangye, which is mulberry leaf, it's a very light leaf and very cooling. And the huangqi, astragalus, and the gojizi, which is goji berry, we call berry, okay? So next one is the lung cancer manifestations. So the patient who has lung cancer, you will see the short of breath and the irritable cough. I'm talking about the irritable cough. That cough is very unusual. You don't have phlegm, you don't have a reason, you didn't get a cold, you didn't get any, for some pollution, whatever, what happened. You suddenly have, not a pollution, talk about, like a phlegm from the nose goes to the throat, and no, it doesn't have all these drainage, whatever. So people start a cough without anything. That we have to be careful. And the blood stain, mucus sometimes come out. Of course, you say, TB can have that too. Yes, but we have to be careful. If anything, cough out blood. Of course, bronchi also can cough a blood problem, but we just have to be careful. Yeah, prevent. And a fever, that's important. If somebody have irritable cough with a fever, short of breath, I'll pay more attention. Lung cancer etiology, that I have to just go fast. The disease is related to inherent factors of the body and or environmental factors. For instance, cigarette smoking and secondary cigarette smoking, which is you smoke and somebody else get problem. air pollution, occupational carcinogenic factor, and for example, the radiation we talk about, right? Other factors, immunology, which is the hypofunction of immune energy. That's why we always say, oh, you have to increase your immune energy. Why? Because you want against the cancer cell. Everybody has cancer, grow or not grow, right? Cancer cell, yeah. Metabolic disorder, that also can cause problem, and endocrine dysfunction and heredity, possible. Lung cancer TCM differentiation, you just see it on screen. In deficiency and toxic heat, maybe if somebody, you see the doctor, acupuncturist will tell you. Lung and spinning qi deficiency, accumulation of phlegm in the lungs, qi stagnation and blood stasis, and deficiency of qi yin and the yang, okay? How do we support it? So first, in Chinese medicine, because this one related with heat, you have lung cancer, sometimes you have low-grade fever. Clear away heat and resolve the phlegm. Have to, clean this airway, and activate collateral and dissipate blood stasis. That's very important too. You don't want to have blood stasis in the lung and bronchi. Acupuncture treatment, which is we use for lung cancer a lot, and the prevention too. Herbal treatment, I put the three of them. Yu Xing Cao, I put the Latin name, and the Bai He, the bulbous lily, and the Qing Hao, called the sweet wormwood, which Qing Hao recently become very famous because of a Chinese researcher. Tu Yu found out also it's good for malaria, for treat lots of patients. But Qing Hao in Chinese medicine we use for thousands of years, also for supporting the treatment for the like a liver cancer type of disease and a lung cancer type of disease. Conclusion: Chinese medicine increases the immune energy and helps to control the growth of cancer cells. Chinese herbs increase the efficacy of chemo and radiation therapies. That's already have a lot and research in China. Lowering the toxic and lowering the side effect from the chemo and the radiation, which is, I just said, dance with the wolf. You can work with together and to reduce the cancer cell growth or to actually stop the cancer, right? And Chinese medicine stops pain without opiate addiction. Remember, a strong immune system is your best protection. 正气, which is we call the positive qi, okay? Positive vital energy. Reduce the stress and calm your spirit is your best investment. Thank you.
All right. Thank you so much, everyone. And now it's time for the professor to answer your questions. So if you've asked a question and you're in the question box on the GoToWebinar, we'll ask it now. So Joanna, Van Knight asks, if a patient is not interested in Western therapy for cancer and wants only Chinese medicine, what is the protocol and how do practices like Dragon and Tiger Qigong work to eliminate cancer?
Okay. Yeah, thank you for the question. Yeah, and of course, the question you just asked, actually, I was going to put it in my lecture because the time is so short, so I didn't. It's a very good question. About the Qigong, it's very important, and I would really suggest this patient to do it. Even now in Stanford University Cancer Center, they have a Qigong teacher help this patient and to practice Qigong and to against the cancer, to fight with the cancer. So yeah, Qigong, whatever what kind of Qigong you do, it's good. I mean, for your patients, whatever your family or your friends. And even if you don't have no cancer, that qigong is good. Qigong Tai Chi always good circulation practice. And the second one is, I see many patients. Actually, your question, I almost met every week. If I don't want to use chemotherapy, no radiation, no such things, I don't want to do it. How do you help me? This is very difficult questions, critical questions, and then also very easy question. Why I want to say that? Because patient knows their body than anybody else. So, of course, we have to discuss with them and help them to evaluate what the gynecology want, the oncology want you to do maybe is the best. Or if you can wait, or we can do something else. But it's really have to discuss with patients and design a very important plan for them. And I do have some patients, doesn't matter who is telling them you have to do chemo, and they just don't want to do it. And of course, in China, I use Chinese medicine, acupuncture, to help as much as we can, and here too. But really depends on patients' own wish, yeah. And we can. Some of the patients actually, they do live very happy life, what they want, without chemo and the radiation. They don't want this side effect. Okay.
All right,
Thank you.
Thank you so much, Van Knight. Grace Liu asks, what are some good TCM formulas that are relied on for raising and protecting WBC during chemotherapy?
Okay. Yeah, the white blood cell during chemotherapy is very critical because not only white blood cell, sometimes the platelets also related. So what you can do is, we have a good herbs. For example, I just mentioned the huang qi, that is very good herbal you can use for you. I don't know which page I can show you, and it's good for your treatment, which is increase the immune energy and protect the patient's immune energy. Yeah, and also I talk about the green tea. It's another antioxidant, and keep going. Yeah, another antioxidant you can use it. Very important, and let me see. I just wanted you to see the number 4 down there. I said the huang qi astragalus. That's the one. Yeah, it's very important. Yeah. Okay. Thank you. Yes.
All right.
Thank you.
Grace also asks, for chemo-induced mitosis, how is it best to protect the mouth and intestinal mucosa lining?
Yeah, that's also the question. Actually, I see some patients because the mucus become a problem, and they can't even eat very, properly because of that. So, do you see? I have this over there, American ginseng, on the screen, and increase in immune energetic. I put a formula as American ginseng for the immune energy, and also American ginseng and Juhua, the chrysanthemum, these two can help increase the mucus. Okay, thank you.
Thank you, Grace. Peter asks, what herbs/supplements should I be taking for ovarian cancer? And is acupuncture effective for this type of cancer?
Okay, ovarian cancer is, a little bit, we call it this cancer sometimes very, it's a serious, sometimes can be, not like a skin cancer, it's easier to treat. Ovarian cancer, if it depends if somebody already had it. Of course, the doctor wants you to do certain treatment, and we have a herbal formula we can help to help the patient increase your immune energy, and the circulation and blood circulation to help. For example, the Chen pea, the orange peel, and the chopped sancha, which is a horizon, and I also use for ovarian cancer patient. And of course, in this one, you also had to be sometimes had to be careful about what kind of hormone products you want. You want to avoid it. Okay. Yeah. Thank you.
So Grace asks, do you use every eusomia or yang formulas for immunoprotection?
Yeah, the yang formula. You talk about the yang formula, eusomia and the yang formula. Yeah, it depends on the patient who's how old is that. You really have to do the diagnosis, and if they have less yang qi or more yang qi, and use different herbs to formulate it. Okay.
All right. Thank you so much, everyone. We don't have any more questions, and it's at the end of the webinar formula, or the webinar, TCM for Cancer Support Symptoms. So we're going to go ahead and close this webinar. Thank you so much for joining us, and Professor Zhao, thank you so much.
Thank you, and if you really need some help, and you can come to Five Branches University Clinic. We have many good practitioners who can help you. Okay. Or if you want to be our students to help a cancer patient, that's great too. Thank you.